Okay, good morning. This is week 8, Disciplinary Action, and we're going to be discussing the role if we were a clinical supervisor and had a student that had poor record keeping, not logging their time, allowing paper requisition to stack up in their binder, and being tardy a few times. So what would be the next necessary steps according to the policy and procedures, while also including why it's important for students to be held accountable for record keeping in the healthcare field? Who would like to start us off?
I don't mind starting. So I think one of the first things that they said would happen is that they would sit down with you and talk about it. And it says discussions and documented in a written student conference forum. Um, I mean, they might give suggestions on what might work better for the student, like organization things. And what was it? It said, oh, why is it important for this student to be held accountable for a good record? Um, as they keep trying to they keep saying that this is a 2-year job interview, right? So I think that if you are getting a job, pe that when an employer is looking for accountability, honesty, integrity, and someone to be dependable. Um, and they want you to be on time, to show up ready, being prepared, and being organized. So they're really trying to push all of this and make sure that you know that it's important. Um, I think it's important because we're responsible for taking care of other humans. They're putting trust in us, so they want us to in all aspects, it comes across. So I, yeah, think it all is important to show that we're organized and ready. So,
I think it also goes back to professionalism, which is
yeah.
what they're trying
Mhm.
to make sure that we engrave that in our brain. Like if we're not keeping like record keeping, then that's not very professional of us, right? There's not going to be any record of what we did, and it's our word against no records. So
Yeah.
I can go after Nikki. As the pretend clinical supervisor, the first thing what Nikki said is that we would have to sit down the clinical student, and from there, I think Professor Seal also said that they try to like install like not like a program, but like a help aid to get you back on track and like just have you have support to be able to get the student able to keep better record system, to also make sure that they can adjust whatever is going on to make them not tardy. Basically, also making sure that they're not taking papers home, like in your clinical book, because that's against HIPAA like violations. So also to make sure that they know that it's unsafe for the patient that they're seeing if they take those papers home. From what I just read on the policies and procedure, and that students need to be held accountable for good record keeping in the healthcare, especially because like protected health information is so instilled into what we do, and anything we do, like overexposing a patient with radiation to keeping their identification and what's going on with them in our personal notes is very scary and not something we should be able doing. So I think that's one thing as a clinical supervisor, we need to make sure that the student is aware of not keeping the patient at risk with keeping some of their information and just having a sit down talk with them before immediately like kicking the student out of the clinic area. It's just to like sit them down and let them know what they're doing is not going to work in a hospital setting.
who would like? Oh.
I would do the same as Nikki and Kylie, just kind of sit them down and kind of discuss what's been going on. And then I think I also saw in the policies and procedures that after, I think, three tardies, they can receive a UPA form, which is the Unacceptable Practice Act. So I think it's just like that what they're doing isn't like adhering to the policies that we have and just try to figure out like what best we can do to accommodate with that person or see what the issue is. And I think documentation is super important, especially in healthcare. Because I think a big part of our job is the hands-on things, but it's also like all the documentation that we do after. I've like worked in healthcare a bit, so something that always stuck with me is if it's not documented, you didn't do it. So it's just super important to like document everything that you can, because if later you get into legal problems or something, you have something to back you up.
Yeah, I could agree with you, Kayla, about how it is important for keeping everything record, because how you mentioned it, that's the only way like you're liable, or it can keep you protected in case someone tells you, oh, you didn't do this. No, if there's a record, I documented that this has been done, and that kind of can back you up a little if something ends up happening. Um, as like record keeping, I think that's important. Um, you can you could consider it as like a legal document, I would think, because everything that you document, even what you do, it's recorded. And like for consent,
Mhm.
there was an assignment that we were supposed to do, and it mentioned that everything that we have to inform them about what we're doing, the risk, the alternatives, treatments, and that's something that you have to document. So that, mm, basically, it is important to make sure that we make a good organized record keeping documents. Um, I was going back to what are the discipline orders that they do for the school program. It does say in the policy procedures how all you guys mentioned about it. And what I found, there's a passage to the policy procedures, and it's called Progressive Discipline Act. It tells you like the steps, and in here it says there's like four steps.
Mhm.
Basically, step one, the professor, the clinical coordinator talks to you. The second, you actually have, it says the instructor documents the second discussion with the student in a formal manner using the electronic student conference form. Step three, uh, the instructor creates a performance improvement plan. And then the final step is after all counseling, mentoring options are exhausted, dismissal from the program shall occur. So um, overall, it, you should put like your best effort in this program and after the program for the
I
safety your patients and your well-being, your
Mhm.
future career.
Yeah.
So it says like it wants you to be the clinical supervisor, right? And then if I'm the student and I'm being unorganized and having poor record keeping, I don't know, like they're trying to think of solutions of what we can do to better ourselves in that way and be more organized. So if
Mhm.
it's like whether or not you need a little bit more time in between each x-ray to like record stuff, trying to figure out what's going to work best for you, right? Do you need to ask your supervisor if you need to have like 15 extra minutes at the end to more to sit down and really be able to log stuff. That way you're not taking stuff home with you, just
Hmm.
to get yourself more organized, trying to figure out what's going to work best for you to succeed.
Yeah. Especially like I asked Professor Fonseca on Monday, he said you can bring like a little notebook and put it in your scrub pocket. And he just said like you can write like if it's the patient's like an adult and then like what they got done and then just put like one or then and he's like, because if you just write it down but don't have like the identification, like the date of birth, the name, the outfit, everything, he's like, you're not it's
Breaking.
not like breaking HIPAA or protect information. And at the end of the day, it's like you're gonna throw it away in the shred that they have there, I assume, in a
Yeah.
hospital. Because like we had like a protected health information that you shred, and then someone from the place
Yeah.
comes and shreds it like professionally for medical stuff. So um, that's something that I learned that they do. But yeah, and then also I saw in the policy and procedures that the UPA it like docks us on our grade. So it also affects us. It doesn't just affect like the patient, like it affects our professionalism and our status of how we are shown to not just our clinical supervisor, but our preceptor and to ourselves. So I thought that was kind of like something that should just be instilled in our brains that we go through clinicals. Like it's not just us that are at risk, it's like everyone that we're around.
Yes. Which also reminds me, Professor Fonseca did mention like it's important that we don't write anything in front of the patient.
Hmm.
We completely like make sure we're aware of that because sometimes like if we're starting off, we're like, well, how are we going to remember like this, and this and this? But I think once we complete the exam, then you can add it to your little notebook as you stated.
Yeah.
But as for like if I was the clinical supervisor and we had a student like this, then I feel like I would first talk to the student, see what's going on. Why are they being tardy or why are they having such a hard time? And see if there's something else going on because sometimes, life can happen and maybe they're feeling overwhelmed and that could be a reason. But I did read that if a student is tardy more than 3 times, they have to be written up for the student conference form. Um, so then that can also lead to you being dismissed. And if you keep having these issues, after the discussion, the supervisor, I can put you on what is it? The progressive, no, the performance improvement plan, where the supervisor discusses and also documents what you're doing and that I had this conversation with you. But if you're still going on and still having these problems after the discussion, after we've already tried to set up a plan for you, then it could lead to a dismissal. Um, and I think it's important to have good record keeping because like as you all stated, it's crucial, right? Like if we didn't document it, it didn't happen. The patient could come back and say like, "Well, she didn't tell me this. She didn't tell me that that was going to happen during the exam. I wasn't aware," and that you can be held liable. Um, and even on Monday, Professor Fonseca said, like it's important that we're daily record keeping. They also go back on that, and that helps the school get their, I believe
Mhm.
it's like their aid,
The other certification
the
for the program.
certification. So I think
Mhm.
it's truly like you have to make sure that even as students now, we get into that habit. Like you need to document everything. If a patient said something, you need to add it on there because it can come back to bite you.
Yeah, I could not agree more.
Okay. Would anybody like to add anything else? We're
Mhm.
all okay?
Yeah.